Hi, welcome to the channel. My name is Dr. Stephen Stokes. I've been in practice for 18 years. I own Advanced Pain Solutions in Southwest Florida. Today, I want to do one of a two-part video series on gastrointestinal conditions and things you can do to help it. Today, we're going to talk about upper GI, and tomorrow I'm going to talk about lower GI. So today is all going to be about the mouth, the throat, and the stomach. So if you have any problems with mouth, throat, or stomach, this is really going to help you quite a bit. I'm going to explain the mechanisms of the conditions, the common conditions, and more importantly, I'm going to tell you some things that you can do to greatly help the condition, if not reverse the condition. So, when you think about the digestive system, it's just a big tube, right? It's a big hollow tube that runs from one end to the other. It's really simple, and we make it complicated when it doesn't have to be. So let's break it down. The mouth is, I would say, often overlooked. And the big thing about the mouth is, of course, that it produces saliva that lubricates everything, also helps break down the food. We know that amylase, which is an enzyme that breaks down carbohydrates, is produced in the mouth. And we know that the mouth is designed to chew. But many people don't chew their food. So the very first thing we need to do is recognize that you use your mouth for the mechanical process of chewing. And that's really important. I would say 80% of the population do not chew their food enough. And you can see this because if you look at your stool, you'll see large chunks of food in your stool that hasn't been digested. So take your time, chew your food. That is my first piece of health advice when we're talking about GI problems. Chew your food. Secondly, don't swallow air. And what happens a lot of times is people are in a hurry, they're chewing, they're chewing their food, they're not really breaking it down. They're taking these big gulps of air with their food. All that air goes into the system and causes problems. So do not swallow air and learn to breathe through your nose, not your mouth. Your mouth is not designed to be a breathing hole. Your nose is. When you breathe through your nose, it has a whole bunch of added benefits. You can read about this, but the big thing we're interested in is problems with the GI tract. We don't want to swallow air, so practice breathing through your nose. If you're a mouth breather, you can easily train yourself to breathe through the nose by putting a small piece of medical tape on your lips every night when you go to bed. It's called medical tape or paper tape. You can get it at any drugstore. You put that on your lips when you go to bed, and it keeps your mouth closed, so it forces you to breathe through your nose. Do that for a couple of nights, and you're going to become a nose breather. And that'll greatly help your gastrointestinal problems. So the other thing about the mouth is that it's connected to the nasal cavities, right? And this is important because, as we're going to see a little later, there's an enzyme in the stomach called pepsin. And pepsin is the enzyme that breaks down protein and helps you digest everything. And it's wonderful, but it needs to stay in the stomach. A lot of times that pepsin can get out of the stomach and get up into the throat and even up as far as the nasal cavities. Now, pepsin in general doesn't activate unless the pH is extremely low. It has to be very acidic for that pepsin to activate, and normally the mouth and the throat and the nasal cavities are not acidic. I mean, they shouldn't be. They should be alkaline, right? They should be somewhere around 6 or a pH of 6 to 7. So if that pepsin gets up in the throat or gets up in the nasal cavities, it isn't going to activate. However, it stays basically active for 24 hours. So it can activate within 24 hours of being put in those areas, and it will activate with an acidic environment. So if you have pepsin in your throat, your nose, or in your mouth as a result of a reflux incident, and that's up there, even if it's not causing you any problems, in the next 24 hours, if you introduce an acidic environment to those areas, you can activate the pepsin, and then it will literally start to digest your skin layer inside your nose, your throat, and your mouth. It'll actually start to digest those tissues and cause you a lot of discomfort. So we want to keep the environment alkaline, and what I would recommend is several times a week, I do this, flush your nose, gargle, and rinse your mouth with baking soda, right? Baking soda, sodium bicarbonate, is very alkaline, and it will keep that area alkaline, and it will wash out any pepsin that could be up there. That's a big big concern. Another problem we have in the mouth, and we see a lot of, and in the upper part of the throat, are canker sores. And they're those little nasty white sores. And those canker sores are the result of a problem between your vitamin D, calcium, and your fatty acids. And I mentioned fatty acids many times in other videos. If you want to, you can run an omega index, a blood test, information about that. And of course, all these products and everything I'm saying is on my website. But for now, if you're getting canker sores, I'm already telling you, you do have a problem with your vitamin D, fatty acid, calcium ratios. What happens is vitamin D is designed to pull calcium out of the gut and put it into your blood. That's what vitamin D will do. And then the fatty acids will take it out of the blood and push the calcium into your tissues. If you're getting canker sores, that's a sign of tissue starvation, meaning that calcium is not getting to those tissues. And as a result of that calcium starvation, the herpes virus is getting activated and you're getting canker sores. So the first thing we want to do if you're getting canker sores is we want to make sure we're taking lots of fatty acids. I mentioned this before. I really like calamari oil, and there are other fish oils that work, good as well. But you want to make sure you're getting lots of omega-3 fatty acids into your body, and make sure that you have a high dose of EPA and DHA when you're doing that. In addition to those fatty acids, you want to also make sure that you're getting calcium. And the calcium that I like with these eruptions is calcium lactate right here. And you can buy calcium lactate in tablet forms. And if you're having a canker sore outbreak, you take 3 or 4 of these calcium lactate tablets, you put them in your mouth over the sore, and you just suck on them and let them dissolve. And that will almost instantly take all the pain out of the canker sore, and you'll see that that tissue will heal rapidly within a day or two. So calcium lactate and omega-3 fatty acids, very important if you're having canker sores. Another thing that you want to know, if you're getting canker sores, you most likely have that herpes virus in your body. And what you want to do is use St.John's wort in a liquid form. St.John's wort, high grade, 1 to 2 liquid form. It's a purple color. You take this, put it on a Q-tip, and you dab it right on the canker sores. By the way, as a side note, if you're getting herpes outbreaks on the outside of your lips and stuff, you can also use St. John's wort on the herpes sores. Works fabulous as well. Because St. John's wort, in addition to being an antidepressant, it's an antiviral. It's actually a better antiviral than it is an antidepressant, believe it or not. And it's proven to kill capsulated viruses. And capsulated viruses are things like herpes simplex. So St. John's wort is going to be a go-to product if you have canker sores or any type of herpes sores that you encounter. Now, next thing is that if you get a lot of tartar buildup on your teeth, especially I get it occasionally on the inside here of your teeth, if you get a lot of tartar that builds up there, that's normally a sign of a phosphorus deficiency. So you just want to simply increase phosphorus, and you can get that from Standard Process and try that. More importantly, though, if you are a person who feels that you need to build up your teeth, if your teeth are eroding and wearing away, I mean, a lot of times, honestly, people who have a lot of acid reflux, which we're going to talk about in a minute, and they have a lot of those acids coming up into the throat and into the mouth, you'll see a lot of erosion on their teeth. The absolute very best way to rebuild your teeth, okay, is with raw veal bone tablets. And the Standard Process name for that is called Biodent, and it's basically raw bone, raw veal bone ground up. That will rebuild your teeth, make them stronger, and it's something that you definitely want to look into if you're getting a lot of erosion in that area. Finally, for your mouth, if you talk a lot like I do, if you're a loud mouth, like people say I am sometimes, for overall health of the mouth and the throat, I can't recommend enough a product called the Standard Process Herbal Throat Spray. And I've talked about this in my other videos. This herbal throat spray has marshmallow root, sage, calendula, echinacea, myrrh, and clove all in one. And it's a pleasant tasting spray, 3 or 4 squirts in your mouth, swish around, hold it, swallow it, And this is going to do a lot of things. It's going to soothe the tissues in your mouth. It's going to deactivate any acidity that's in there. It is going to boost your immune system. I mean, you got to think about it. You're getting all of that, the ear bacteria and a lot of those nasties are coming in through the mouth as you breathe and in through your nose. This helps to neutralize a lot of that. And of course, it has the clove as well, which is a proven way to combat a lot of those nasties. So I recommend this herbal throat spray. You just keep it in your I was almost said in your purse. Everybody can have a purse nowadays, right? So keep it in your purse or your man bag and use a couple of squirts throughout the day as you find your throat getting dry or congestion or anything like that, and it really helps quite a bit. Let's move on to the throat since we're heading down that way. The throat is a very sensitive issue, a very sensitive area. The tissues of the throat have a super high cell turnover rate, which means that they're sloughing off and regrowing rapidly, which is cool. And they need to do that because we're always losing cells as we swallow every day and stuff. Problem is that it makes it a real hot spot for things like throat cancer, right? Because of the high cell turnover rate. So we want to keep our throats super healthy. And the throat comes down, and at the bottom of the throat, there's a valve called the lower esophageal sphincter, the LES. This is going to be the primary focus of what we're going to talk about when it comes to the throat, because that LES is designed to stay closed and keep the acid and the pepsin in the stomach. And that's what it does. And that's good because the stomach has a low acidity, right? A low pH, and the throat is supposed to be more alkaline. And we don't want the acid in the throat. But of course, as we all know, that is not what tends to happen. That lower esophageal sphincter tends to weaken with stress. Now, I know that there are foods that weaken it as well, right? Coffee, chocolate, bad oils, uncooked onions, peppermint, carbonated drinks, right? The bubbles. A lot of that stuff will weaken the LES, but in my opinion, man, nothing is going to weaken it like stress. So if you're having a problem with reflux, where your LES is opening, you're getting heartburn and reflux and all these things, you've got to get the stress under control or nothing else is going to work first. And what I recommend for the stress is to take a product called Aswagandha. I've made separate videos about this. Aswagandha is my go-to stress tonic. And then if you need to go beyond that, I would recommend Valerian Complex. Valerian Complex has some powerful herbs in there, like valerian root, of course, and a passion flower. This stuff is going to really trank you out, calm you down. You've got to get the stress under control. Once you get the stress under control, then you can begin to try and strengthen that lower esophageal sphincter. It's an autonomically controlled valve, so you can't exercise it as per se, but I have found that increasing calcium lactate in your diet, so adding calcium to your diet, specifically calcium lactate, which is a really bioavailable form of calcium, adding calcium to the diet and doing breathing exercises really helps with strengthening the LES. Also, if you have a weak diaphragm, so your diaphragm is this muscle down here, if that is weak, that can cause a problem as well, where you get a hiatal hernia. This is where your stomach can actually slide up where it doesn't belong and cause all sorts of digestive problems as well. If you have a hiatal hernia, then good news is that unless it's a really severe case that needs surgery, most of the time that can be literally manually treated, where you can go in and you can pull that down and reset it, put it right in the correct spot. I've done that many times in the clinic. Most manual therapists, chiropractors, physical therapists, even massage therapists who are trained can do hiatal hernia treatments, and that helps a lot. Back to the throat. If you have a lot of damage to the tissues of the throat because of reflux, first you want to get the stress out and get that to stop, right? Stop the reflux. But then after you do that, you need to heal that tissue. Nothing is better for healing the tissue of the throat or the mouth other than taking collagen powder and Gout Kola. Collagen powder is self-evident. There's a lot of different brands. I believe that my wife has a brand called Vital Proteins in our cupboard that we use. And you want to use collagen powder to help the body repair tissue. And then you want to couple that with a herb called Gout Kola. And Gout Kola is it's called Gotu, by the way, Gotukola, Gout Kola. It is the herb to promote angiogenesis, which is the proliferation of blood vessels from existing blood vessels, something you absolutely need to do if you're trying to vascularize an area and get it to heal properly. So that's really important. Now we get to the good stuff, right? We're going to talk about the stomach. So we already mentioned in the stomach we have the lower esophageal sphincter, which is closed, should be closed, keeping the stomach pH low. Now the stomach's job is to basically break down your food, right? I like to call the stomach the washing machine of the GI system because it's like a big washing machine. The stomach has to have a pH of 3 after you finish your meal to be effective. And don't worry, because the stomach has mucus on the lining of it that protects it from the acidity. The stomach makes a product, by the way, called chyme. That's what's going to move out of the stomach and into the small intestine. We're going to talk about the small intestine, the colon, and the rectum tomorrow. But right now we're in the stomach. Pepsin we talked about a little bit. Pepsin is the primary digestive enzyme in the stomach that helps break down the protein. And that pepsin needs to be in an acidic environment to activate, which we talked about already. The gastrin is a hormone, and it's released for the stomach for digestion, and it increases motility of the stomach, but it signals the gastric acid to be released. And that gastric acid has to be released to activate the pepsin, to break down the protein, and that acid is regulated by the pancreas, because the pancreas releases something like sodium bicarbonate. And the sodium bicarbonate keeps the acid in check, and everything works in a beautifully balanced way. Until you go to your doctor and you tell your doctor that you have acid reflux, and he gives you a proton pump inhibitor, something like Prozac, right? And when you take that, what happens is it starts to shut off the release of the stomach acid, and you get some immediate benefit. But now your stomach acidity drops. It has trouble maintaining a pH of 3 while you're trying to digest your food, so the protein doesn't get digested properly. Also, the lower esophageal sphincter, which has to have that high acid to stay shut, it gets a signal that the stomach acidity is no longer low, and it becomes weak, and it becomes leaky, and it begins to open when it shouldn't open, all because you're taking antacid medicine, right? Now, the gastrin that we mentioned, the gastrin, which is the main signaler that signals the acid to be released into the stomach, that doesn't stop being produced. So your body goes, there's not as much acid in the stomach anymore. That's interesting. Let's just increase gastrin production. So your body starts pumping out more and more gastrin, and your proton pump inhibitor, your Prozac, your omeprazole, right, that you're taking, it just keeps the acid low, and you keep increasing your dosages to keep your acid low. And your body gets more and more aggressive and starts producing more and more gastrin. And guess what happens when you go off of your acid medicine? You get a rebound effect, right? So you then try to get off of omeprazole, and what happens is man, you get all that gastrin production and you get all that acid production. It just quadruples, and you become more sick than ever. So it's not the right way. So what is the best way? A much better way is to, if you're getting acid reflux, is to first of all test yourself for 2 things. Go and get a H. pylori blood test. If you have H. pylori in your stomach, that is going to cause all sorts of problems, because that little bugger eats away the mucus layer of your stomach, exposes it so that the acid can damage the stomach. We have to get rid of it. It's very common. If you have H. pylori and you want to get rid of it, guess what? You can do it with garlic. And I spoke about this before. Get Garlic Forte from Standard Process. Start taking that. Take it for 10 days and never have a problem with H. pylori again. Kill that nasty. The other thing I want you to test for is I want you to test for HCl, hydrochloride. I want you to test for acid sensitivity. Okay. The next thing I want you to test for is acid sensitivity. I want you to take 2 teaspoons of apple cider vinegar in 4 ounces of water, and I want you to drink that. So the next thing I want you to test for is acid sensitivity. I want you to take 2 ounces of apple cider vinegar in 4 ounces of water, and I want you to drink it on an empty stomach. If you experience a burning sensation, I want you to immediately take some sodium bicarbonate, some baking powder, and that'll put the fire out. But if you had that reaction, then most likely you have some sort of erosion in that mucus layer of your stomach, and you may have an ulcer. If you have that, you cannot start increasing stomach acidity with supplementation, which is what I'm going to recommend as the go-to cure for most stomach problems. You can't do that because you've already got a protective layer of mucus in there that's being eroded away, and you may have an ulcer. So you try the test. If you get a burning sensation, then what I want you to do is I want you to first concentrate for 2 weeks on healing the stomach layer. We do that with chlorophyll, okay? Chlorophyll. We take chlorophyll, that's going to soothe the stomach layer, and it's going to help it heal. That's the answer. Then, once we test negative on that apple cider vinegar test, in other words, once we can take 2 ounces of apple cider vinegar and 4 ounces of water, not get a burning sensation, then we start to have a lot of fun. Then I want you to take a product called Zypan. And Zypan is a combination of acid and pepsin to help you digest your food. You're going to start with just taking 1 at each meal, and you're going to continue to increase that up to 5 at each meal. You're going to take it about halfway through the meal until you start to get some burning discomfort. And that's your signal to back off. Most people are going to end up with somewhere between 3 to 5 of those with each meal, depending on the type of food you eat. If you're having a salad, you may only need to take 1 or 2. But if you're having a steak, you probably need to take 3 to 5 of those. What that's going to do is it's going to acidify the stomach. It's going to help you break down the protein properly. And it is going to stop you from having acid reflux because it is going to send a very strong signal to that lower esophageal sphincter valve, close. It's going to keep your stomach nice and acidic where it belongs. Now, back to the idea if you test positive on that test. So if you take the apple cider vinegar test and it burns, now what are you going to do, right? We don't need you to suffer. You're going to take the chlorophyll complex, like I mentioned, for about 2 weeks. That's going to heal the irritation to your stomach. But in the meantime, you're still having a problem with digestion of proteins, right? This is what's causing all this reflux and all these problems. You don't want to take a proton pump inhibitor. You don't want to be taking omeprazole or one of these nasty medicines. So what do? Well, there's a product, and it's called Enzycore. And Enzycore is a digestive enzyme supplement from Standard Process that doesn't include HCl. So there's no acid in that product. So that is a safe product for someone with an ulcer to take with their food to help digest their meals. So why wouldn't everybody just take Enzycore instead of taking the Zypan with the acid? Well, because the Zypan with the acid and the pepsin is the best product. That's why. Nothing is going to digest protein like Zypan. But the Enzycore doesn't have the acid. There are other enzymes in there. So you can, like I believe that uses papaya or bromelain and things like that. So you can take those plant enzymes and you're not going to have any flare-ups of the ulcer, and it's going to assist you to still try to get that under control. It won't work as good as the Zypan, but you need to use that for the first 2 weeks while you're healing your stomach before you switch over to Zypan. Also, I have some patients that are vegetarians, right? That's fine. If you're a vegetarian, for whatever reason, I'm okay with that, but you're not going to want to take Zypan because Zypan comes from cows, right? It comes from animals. So you're not going to want to ingest that product. Instead, you're going to want to take Enzycore and work with plant enzymes. That's probably what you're going to end up doing. I'm okay with that. Also, remember, finally, that in order to heal, you need sleep. Specifically, if you're trying to heal your throat, if you're trying to heal your stomach, and you're not getting enough REM sleep every night, you're going to have a lot of problems with that. And I would suggest you watch my video on sleeping if you're having problems with sleep. So there's a couple of quickies on the mouth, the throat, and the stomach. I hope it was useful. Tomorrow I'm going to do one on the small intestine, the colon, and the rectum. We're going to cover what you can do about common problems that are down there. Please subscribe to the channel. A lot of information on this talk. Reach out with any questions. Go to my website, drstevenstokes.com, for show notes and for insights, product lists, things like that, and free downloads of my books. By the way, if you're interested in this topic, my book, Heal Yourself, The 7 Steps to Innate Healing, this is where all these talks are coming from, right? I actually wrote show notes for myself that I took from my book. So if you're interested, just download a copy of Heal Yourself. There's a whole chapter on digestion that breaks everything down nicely. Okay, that's all I have to say about that. I hope it was useful. Don't forget to subscribe, and we'll talk again tomorrow. Thank you very much.